Hello guys, welcome back to Medicine PYQ topic series, and the episode 16 I have chosen is hypothyroidism. Again, a very important topic. So let's get started. So the questions which came in Neet 2018 and 2020 were question number 1, which of the following conditions is associated with AB block? Options are hypothyroidism, Cushing syndrome, hyperthyroidism and pheochromocytoma. And second question is, a patient came to the hospital with complaints of lethargy, increased sleep and weight gain. Investigations revealed low plasma TSH concentration. However, on administration of TRH, the TSH levels increased. Which of the following condition is likely in this patient? Options goes hyperthyroidism due to disease in the pituitary, hypothyroidism due to disease in the pituitary, hypothyroidism due to disease in the hypothalamus, and hyperthyroidism due to disease in the hypothalamus. So to answer such questions, we need to have an idea regarding hypothyroidism and the thyroid gland and various clinical features how patients present. So let's get started. So before we get into the clinical picture and laboratory findings of a case of a hypothyroidism, first we should know how this axis is working and how the thyroid hormones are regulated. So point to be noted here is T3 and T4 hormones are having a negative feedback to both pituitary gland and hypothalamus. So the axis starts with hypothalamus releasing thyroid releasing hormone TRH, and it is stimulating pituitary gland to release thyroid stimulating hormone TSH, which is ultimately acting on the thyroid gland and releasing T3 and T4, which acts on the end organ and the peripheral tissues. Once this T3 and T4 goes up, it have a negative feedback to both pituitary gland, that is TSH, and to the hypothalamus, that is TRH. So it is very important to understand this axis because defect in any of the pathway can be the cause of the hypothyroidism. Moving forward, coming to the causes of hypothyroidism, so it could be autoimmune diseases, or it could be a removal of part or all of the thyroid gland. It could be radiation treatment. In congenital, if a person is born with it, then certain medications which is depressing the thyroid function. Then dietary causes like iodine deficiency in diet, a very important cause. And it could be a damage to the pituitary gland or a damage or inflammation of the hypothalamus, and various unfavorable environmental factors. So these are various important causes of hypothyroidism. Coming to the clinical features, again this is very important. You just need to remember one thing, that whenever thyroid hormone levels are decreased in the blood, it slows things down. This is a very important thing. It slows everything down. Based on that, you can remember many of the symptoms. So certain generalized symptoms like weight gain is an important symptom, decreased appetite, cold intolerance, sensitivity to cold. Then on heart, there is bradycardia, hypertension. On GI, there is constipation. Neurological presentations like fatigue, depression, impaired memory, impaired concentration. Then dry skin, hair loss, coarse hair, brittle hair, thin nails, and edema, carpal tunnel syndrome, fatigue, lethargy, are certain other clinical features of hypothyroidism. These are important points which needs to be remembered because these will be given as clinical clues in the question, based on which you have to identify the condition and move forward with the question. Coming to a laboratory picture, so there are two possibilities. One is high TSH, one is normal TSH. So when TSH is high, if T4 is low, it is a primary hypothyroidism. If TSH is high and there is a normal T4, it is subclinical hypothyroidism. Again, if TSH is normal and there is low T4, then it is secondary hypothyroidism. That could be a cause because of pituitary or hypothalamus. So this is a very important table which you should understand. You should be thorough with this. You can keep a screenshot of this because this will help you in cracking the question. Now, when there is elevated TSH and normal thyroid hormone levels, how to go about it? So when TSH levels are 5 to 10 and there are symptoms of hypothyroidism, we definitely treat it with a 3 to 6 month trial of levothyroxine therapy. We also check TPO antibody. If it is positive, we consider the therapy and annual thyroid function test depending on patient preference. And if it is negative, we keep repeating thyroid function test every 3 years. And if TSH is more than 10, we treat with the levothyroxine therapy irrespective of any other findings. Lastly, we'll just compare hypothyroidism with hyperthyroidism because it goes hand in hand, and hyperthyroidism is almost opposite to hypothyroidism. So in hypothyroidism, we find weight gain, whereas there is weight loss in hyperthyroidism. We find cold intolerance, whereas there is heat intolerance in hyperthyroidism. We get a slow heart rate, that is bradycardia, but we get a tachycardia in hyperthyroidism. And patients generally have depression and irritability in hypothyroidism, whereas there is nervousness and anxiety in hyperthyroidism. and features like fatigue, insomnia and hair loss are certain common features to both of them. So this is important because you need to identify the condition based on the clinical features which will be given in the question, so that you don't get confused just with the lab picture. Now going back to the question, so the question which came, which of the following condition is associated AV block? Hypothyroidism, Cushing syndrome, hyperthyroidism and pheochromocytoma. Now AV block is associated with bradycardia, and we know Cushing syndrome, hyperthyroidism and pheochromocytoma are all associated with tachycardia. So that rules out these three options. Also hypothyroidism, as we just discussed, is associated with bradycardia. So the best answer here is hypothyroidism. Second question, a patient came to the hospital with complaints of lethargy, increased sleep and weight gain. Investigation revealed low plasma TSH concentration. However, on administration of TRH, the TSH levels increase. Which of the following conditions likely in this patient? So first we need to determine whether it is a hyperthyroidism or hypothyroidism. Then we will decide the level of defect. Going back to the question, it is given that there is low plasma TSH concentration. So this is where you can get confused just seeing the lab picture. You definitely have to see the clinical features as well, where it is given lethargy, increased sleep and weight gain. So these are all features of hypothyroidism, where there is lethargy, increased sleep and weight gain. Plasma TSH concentration can be low in hypothyroidism as well. So here hyperthyroidism is ruled out. Now we have got two options, B and C, where the disease is either in the pituitary or it is in the hypothalamus. But when we see the second part of the question, it is given on administration of TRH, the TSH levels increases. That means there is a deficiency of TRH in this patient, and when we administer a TRH from outside, the TSH levels automatically increases, and we know TRH is secreted by hypothalamus and not pituitary gland. So the defect here is in the level of hypothalamus. Hence the answer here is C, that is hypothyroidism due to disease in the hypothalamus. I hope this is clear. This is why clinical features are very important other than the lab picture as well. We can just go back to this lab picture where we just discussed. In secondary hypothyroidism, the TSH level can be normal or low, which was in this question, and the cause could be from pituitary or hypothalamus, where the cause was hypothalamus in this question. I hope guys the question is clear, and you can attempt such questions if it comes in the exam with the help of this table and also the clinical features I just discussed. This topic is a very huge topic which cannot be discussed in this revision series in detail, but I hope you get a gist of the topic. Till then, keep studying, keep revising. I'll see you in the next episode. Cheers.